This is a device that's been needed in medicine for at least the last 25 years, and I've been involved with sleep medicine for almost 30 years. The biggest area that really concerns me is because of my work as a critical care physician, I see patients almost every week who should have been evaluated in an outpatient setting, but didn't want to do it, or couldn't afford to do it, or couldn't spare the time to do it. The typical case was the fellow that I'll just call Al. Al was a 58-year-old guy who came into our hospital with an acute myocardial infarction. He went to the cath lab immediately from the ER, and I was called to the cath lab by the cardiologist because they gave him a little sedation and he was stopping breathing during the middle of the heart cath. We put him on a BiPAP apparatus in order to stabilize him during the heart cath, and he came back to the intensive care unit. There we monitored him, and we could observe him during his naps and sleep, stopping breathing more than 30 times an hour with significant oxygen desaturation. The patient had significant hypertension. He had significant problems with his weight, as he was about 6'2", but weighed about 270 pounds. The guy was a long-haul truck driver. He owned his own rig and his own business, and he just couldn't afford to take time away from his work. I had a long discussion with him about why he needed to be evaluated further for sleep apnea. He didn't want to have anything to do with it because he was afraid the DOT would take his trucker's license away from him. I gave him all the information from the Department of Transportation indicating that even if he had sleep apnea, he could be evaluated and treated, and then if he was successful, he could continue to drive his truck. To make a long story short, Al left the ICU, refused to have any further follow-up, and now we don't know whether Al is out there with possible danger to one of our family members because of his sleepiness, or whether Al will have another heart attack because of his severe sleep apnea, or whether Al will just have other complications from his long-term disease. I think our device could have solved a lot of problems early in Al's career, making an easy situation for him to have a sleep study while he's on the road, to document whether he's sleepy or not after the test is completed, and to allow him to move through his life without so many steps away from his own business. That's just one of the reasons I think the OneConnect is going to be a really beneficial tool in our armamentarium to help evaluate patients with sleep disorders. Thanks for giving me this opportunity to speak with you, Chris.